Hello everyone. It's been a while since I made a video on MRCOG preparation. Apologies, I have been busy. But this video seemed more important at this point as I've recently started working as a junior doctor in obstetrics and gynecology. When I was preparing for my interview, I couldn't find the information that I needed to prepare myself from. I thought this could be a video that would probably help my colleagues here and overseas who have doubts about what it's like to work as a junior doctor in an NHS organization. So here we go. The title SHO or a senior house officer is given to a junior grade doctor in any department. It could be trust grade doctor, that means one employed by the hospital, doctor from foundation training program, which is after attaining medical degree from UK, specialty training in the first or second year of their training, or a GP trainee. The most important question, salary. How much will I be paid? The basic salary covers 40 hours per week. However, you will then receive uplifts according to any evening, night, and weekend hours or on-calls that you are asked to do. Each role will carry its own rota, and the exact breakdown of hours will determine the uplifts. So, the total salary would be basic pay plus additional hours plus night rate plus weekend allowance. This scale is fair as you are paid according to the hours that you work for. Approximately £35,000 to £45,000 per annum without the taxes. Now what does the job profile include? Starting with clinical duties, which would be on-call shifts, theatres, clinics and elective caesarean section. The on-call shifts start with handover using SBAR tool, that is situation, background, assessment and recommendation. There are usually two separate teams, one for obstetrics and one for gynecology during daytime, and only one team covering nights, weekends and public holidays. We usually carry bleep and Vocera, but again this depends on different trusts. Soon after handover, we prioritize the patients that need to be seen first. All the clerical work is yours, no doubt. The doctor's notes, prescriptions, discharge summaries, it's all yours. Yeah, that's how you're going to look on an on-call shift. In obstetrics, basically the work would be to have ward rounds with your team in delivery suite and maternity wards, assist in difficult vaginal deliveries and cesarean sections, manage obstetric complications, manage patients in day assessment unit, which is basically A&E for obstetric patients, and to look at all the unfiled reports. In gynecology, work would include ward rounds with the team, assist emergency theatre, manage patients in surgical decisions unit, which is A&E for gynecology patients, and to look at all the unfiled reports. Unfiled reports are investigations that need to be followed up or were pending, which require appropriate management. There are many clinics depending on the trust. Basic ones would be general gynecology, antenatal, postmenopausal bleeding clinic, rapid access clinic, abnormal uterine bleeding clinic, infertility, chronic pelvic pain, and urogynecology. In clinics, the basics: history taking, examination, provisional diagnosis, investigations, and management. It's really important to have good patient communication in order to build trust. Always check the management plan with your senior colleague. It could be a senior registrar or a consultant. Recheck if the patient needs a follow-up or needs to be discharged from the clinic. At the end, dictate the letters for GP or other specialties. Theatre sessions start with pre-op rounds, where you would check the operating list, recent investigations, scans, last hemoglobin, VT risk assessment, BMI, need of antibiotic, allergies, and sign the WHO checklist. You would be assisting or performing the surgery depending on your previous experience. Last would be post-op rounds, where you would debrief the patient, prepare discharge summary, and prescribe the medications that she would need. Also, inform the on-call gynae team about all the surgical patients in ward. Elective caesarean section. Pre-op rounds would start by checking the indication for caesarean section, medical comorbidities, BMI, placental location, latest hemoglobin, consent forms, tubal sterilization, presentation scan for breech baby, and signing WHO checklist. You would assist or perform the surgery depending on your expertise and the complexity of the procedure. Post-operatively, you would need to check the VT score and prescribe tinzaparin or enoxaparin accordingly. Prescribe antibiotic if needed. And if there are any concerns, Notify the on-call obstetric team. Non-clinical duties include taking part in an audit project or research project, taking part in teaching, which would be CTG meeting or clinical presentations. For these, separate admin sessions are allotted almost every week. There are mandatory trainings that every doctor has to attend. Some are from the trust, which are fire safety, preventing radicalization, equality and diversity in human rights, health safety and welfare, and so on. Mandatory trainings by the department would be maternity training, CTG training, skills drills, safeguarding child, safeguarding adult, and so on. Now, what does the future hold? If you're working as a trust grade SHO, it's easier, well, comparatively easier, to work towards your competencies and to prepare yourself to enter the specialty training at ST1 or ST3 level, depending on your experience. Things to remember. Good medical practice by GMC, which describes what it means to be a good doctor. Always cross-check your diagnosis and management. Listen to your colleagues. Challenge your colleagues in a positive way. For instance, if there's a conflict about management plan, explain yourself with reasoning. Examine a patient with chaperone and document it. Always be aware of your limits. Never hesitate to ask for help. Ask questions. There is no question that is wrong. Not asking a question is definitely wrong. Thank you for watching the video. This video was based on my personal experience and research. If you did like the video, please give it a thumbs up, share it with your friends and colleagues, and subscribe to my channel. Thank you. Have a nice life.